Good evening, everyone. Welcome everybody to today's TREVEC webinar series and public health education. We welcome our clients. We welcome the doctors amidst us today and every other individual that has deemed it fit to join us in today's webinar series 8.0. More so, we appreciate everybody that has been following us in our previous webinar series. We appreciate every one of you. Say thank you all. We also appreciate everyone for the time taken out of your busy schedule to join us in today's webinar series. The aim of this webinar is to create an enlightenment and public health education to educate the general public on how to improve or maintain a good health vision status. My name is Okoyemi George, moderator for today's section on glaucoma, the silent thief of sight. I repeat the topic once again. Glaucoma, the silent thief of sight. Glaucoma is often called the silent thief of sight because it usually develops slowly and may not show noticeable symptoms in its early stage. Many people may not realize they have the condition until significant vision loss has already occurred. Gone are those days when it said that glaucoma only affects the adults, but recent cases has shown that the young ones are not exempted. Unfortunately, glaucoma is one of the leading causes of blindness worldwide. So this is a very important topic for us today to learn and know more about this eye condition. So I will urge everybody to sit down, take our pen, and jot one or two things down. Before I introduce the speaker for today, I would like to urge us all to please, we should mute our speaker to avoid any distraction in today's webinar. Thank you all for that. Now, it is my pleasure to introduce our speaker for today, Dr. Osazee Agbonlahor. Dr. Osazee Agbonlahor is a seasoned optometrist with several years of experience in eye health education. He has contributed significantly to the optometry field, and today we'll be sharing insights on glaucoma, the silent thief of sight. Please join me to welcome Dr. Osazee Agbonlahor. Dr. Osazee, over to you, sir.
Thank you very much, Mr. Okoye. I'm sure you can hear me loud and clear.
Yes, I can, sir.
Loud and clear. See me clearly, rather. All right. So thank you so much for that introduction. My name is Osazee Agbonlahor. I am an optometrist and of course a public health educator. Thank you, everyone. I really appreciate your presence. Thank you for following us thus far. This is our 8th webinar series as far as health is concerned. Just like we promised you, we are still cooking a lot of things in the pipeline. This is not only for eye health, but for general health. So we are speaking with other health specialists that will be coming up subsequently to tell us or educate us about other aspects of health But as it stands now, we'll be talking more about eye health, pending when we have another specialist that will be coming on board to talk about other health concerns. The idea, just like the moderator has said, is to educate the public about their health generally. All right, so coincidentally, this presentation is in line with the World Glaucoma Week. Throughout this week, we have been celebrating the World Glaucoma Week. And there's another time, or that time of the year is set aside to talk about glaucoma. And just like we have mentioned, and I'm sure most of us here know about glaucoma as a silent thief of sight. It is still very, very, very subtle. It's a very subtle disease that we all must be aware of. And so this whole week was set aside to create awareness, to ensure that people get tested, to also educate people about what glaucoma is about. And of course, our periodic webinar series, we felt that to also commemorate this week, we need to talk about glaucoma. And so whatever you're going to be hearing today, though championed by TREVEC, that's Treetop Vision Eye Center, but we're using it to also commemorate the World Glaucoma Week. And I hope that at the end of the day, this presentation will contribute significantly in reducing this burden that glaucoma has caused us. So without wasting any further time, this presentation is about an hour. So we'll delve into what we need to talk about today. So once again, my name is Osazee Agbonlahor. So these are the objectives for this presentation. Very quickly, we're going to be looking at what glaucoma is. We're going to talk mention some statistics, and then we'll look at the pathophysiology. For some of us that don't understand what pathophysiology is, pathophysiology simply means the cause, okay, the beginning, the etiology. That's another grammar. All right, the cause, I think that's better. So you could use that to understand what pathophysiology is, because we get that a lot in the clinic. Oh, doctor, what causes glaucoma? What is the process of glaucoma? How does glaucoma make you blind? All right, so or how does glaucoma cause visual impairment? All right, we're going to be looking at that also very, very briefly and as basic as possible. We're also going to be looking at some risk factors that is associated with glaucoma. We're also going to be looking at common types of glaucoma, and of course, the treatment and of the diagnosis, and as well as how it can be treated. Then lastly, which is very, very important, uniting for the glaucoma-free world. Everyone desires, especially those of us in the eye care world, we desire that one day, someday, the population will be free from this burden. And just like it was mentioned by the moderator, glaucoma is actually the leading cause of irreversible blindness. Yes, cataract tops the lists of the leading cause of blindness worldwide. However, cataract is reversible based or depend on the type of cataract and if it stands alone, if it has some comorbidities. However, glaucoma is the leading cause of irreversible blindness. So you see, you don't have, there's really no hope much as far as glaucoma is concerned. As we stand today, there are a lot of work going on. Okay, maybe I'll leave that for the treatment part. So let's move on. So what's glaucoma? We've been asked these questions a couple of times, especially by our patients or our clients. When you tell them that they are glaucomatous or they are a glaucoma suspect, or perhaps they have been diagnosed with glaucoma, and they ask you what it is. Glaucoma is actually a group of disease, so it's not just one cause. In fact, you'll come to hear later that the cause till tomorrow is still unknown. What we just have are explanations based on what science feels happening, behind the eye. So it's a group, it's a myriad, it's a matrix of eye disease that causes damage to the optic nerve. Okay. When you talk about the optic nerve, you talk about, or just like I put there, think of it as, wires, plenty of wires or cables, that connects the eye to the brain. And these cables or these nerves are so fragile that when they are damaged, or when the damage starts from one end, it must get to the other end. So you can't stop it. You can't stop, the damage, the damage that has begun. Okay, in medicine, we call that apoptosis. That's programmed cell death. As far as the damage has started somewhere, it must get to the end. Now, the question is, when did you notice that this damage has started? The earlier you notice it, then the more intervention you can get. So it is a damage of this optic nerve that cannot be remedied. Just to also mention, the eye is a direct offshoot of the brain. So the nerve cells, or the cells that are within the brain, the constituents, the makeup of that cell in the brain is similar to what makes up the optic nerves. And just like that brain damage is mostly permanent, you don't have you don't have cure for that. The same it is as far as these nerve cells are concerned. All right. What causes, most times when patient comes in, I will tell them that your pressures are high, and that's why you have nerve damage. Okay. And they ask, okay, why is that the only cause? It's one of the most known risk factor, because it's not the only cause. It's one of them that science have established that could cause damage to these nerves. When the pressure in the eye is very high, we call it high intraocular pressure or elevated intraocular pressure. That can cause damage to the optic nerve, because like I mentioned earlier, the optic nerve, they are so fragile, and any little pressure around within them can cause them to be damaged. And also, we also say that it is so subtle in nature. Glaucoma have no warning signs. It's one of those diseases in the healthcare sector that have no warning signs. It doesn't tell you that I am coming. It doesn't give any symptom. Okay, symptoms are what the patients feel. It doesn't have any symptom. However, only the optometrist or the eye care practitioner can tell you, okay, based on what I'm seeing at the back of your eye, you may be a suspect for glaucoma. And another thing I also want us to know about glaucoma is that the loss or this damage we see it doesn't just come up once. All right. The damage is so gradual, it is so subtle that it can be noticed easily. So if a patient have glaucoma, you may not even know. You may never know until vision is totally lost. You may never know until it's at the end stage. And that's where nothing, can be done. All right. So this is what glaucoma is. I'm trying to, just give a balance so that I don't go so deep to get some of our participants here lost about medical jargons and all of that. So this is what glaucoma is. Let's take a look at some statistics. Just like we have mentioned earlier, glaucoma is the leading cause of irreversible, please mark that word, irreversible blindness worldwide. And you see that it's estimated that about 76 million people have glaucoma. And this number is projected to reach about 111 million people in the year 2040, which is close by, just less than 14 years from now. And just to also buttress what I said earlier with statistics, 50% of these people that have glaucoma, don't even know that they have it. They are not aware because glaucoma is very subtle. And that is why it is termed today as a silent thief of sight. Thieves are usually silent. They tiptoe to come do what they want to do. But this one is a silent thief. We have to qualify it that way because it is truly silent. Now, I'll just tell you briefly about the pathophysiology, how glaucoma can lead to damage of these nerve cells. Just picture, I told you before that there's pressure in the eye, and just the eye is a ball. And just like every ball, whether your football or let's say your tire, for those of us that drive, there's a pressure that keeps your tire or your football firm. Okay. Now, if that pressure within the ball or the tire is low, you have to go top it up. That's where you visit the vulcanizer to, inject air into the tire or the ball for it to become firm again. But there's a point where you inject air into that tire or ball, that it is so tense that it could burst. All right. That's exactly what happens within the eye. The eye is just like a ball. Now, there is something that keeps the pressure within the eye steady. And that is the process of fluid production. Okay, so at the back of the eye, there is fluid being produced and as well as fluid being removed. So the rate of production equals the rate of removal. So what is produced is equal to what goes out. And that creates an equilibrium. That creates a balance. All right. Now think of it as an overhead tank that you're pumping water or you're channeling water into. If the rate of pumping water into that tank equals the rate of letting water go out of that tank, you will observe that that tank will never be full. It's just going to have, there's going to be a balance between inflow and outflow. That's exactly how the eye structure is built. So when this fluid is being produced from what we call the ciliary processes, all right, it flows out through a channel, okay, we call the trabecular meshwork, where it goes out of the eye. Now that balance is there. However, sometimes you could have, production of fluid more than removal of fluid. If that happens, pressure builds. And when pressure builds, it causes damage to those fragile nerves we mentioned earlier. That's one way. Another way is when there's the rate of production is normal. However, the drainage is affected. So where you have the drainage system, if the drainage system is blocked, just like you have in your sink or in your drainage, regular drainage on the road. When it is blocked, you have an erosion. All right. So the same way it is when the channel where water should go out of the eye is blocked or narrowed, then it means that fluid will definitely build up. And when that happens, you could have some form of damage to the eye. So all that I've mentioned now talks about IOP, that's intraocular pressure. But studies have also shown to us that even when the pressure is normal, all right, glaucoma can still occur. Even when pressure is normal, you have normal inflow and normal outflow, there's no blockage of the drainage and all of that, you can still have damage to this nerve. And so studies have pointed to what we call ocular perfusion pressure. That simply means the supply of blood to that area we call the optic nerve head, that area where all the nerves are gathered. Remember, they are cells, and of course, they will need some supply, to survive, just like every part of the body. So if blood flow to that area is, reduced, we call it low ocular perfusion pressure. If that happens, then the nerve cells can also die. So this is not just only about pressure buildup due to fluid, the alteration or the imbalance between fluid inflow and outflow. That could be normal, but studies have shown that when you have low ocular perfusion pressure, that can also cause the damage to these nerve cells. Aside that, there's also what we call high glutamate level. Studies have shown that in glaucoma patients, that there's high glutamate within the eye, in the vitreous. All right, and you see this high glutamate level is found mostly in most of these seasonings. We call it monosodium glutamate. That is why it is advised that you should manage or to reduce the way you eat, take in seasonings. That's what you use to season your foods. I won't mention any brand now, but there are lots of them in the market. At some point, many years ago, there's one particular brand that was so high in monosodium glutamate that, was attributed to cause of glaucoma or damage to the optic nerve head or to the optic nerves themselves. So, as size pressure build up, you could have normal pressure, but damage can still occur. So take note, it's not just only about high, intraocular pressure. Other things can still cause glaucoma to occur, as I mentioned earlier. Now, what are the risk factors? Risk factors means that these things predisposes one to having glaucoma earlier than others. Now, age. In fact, I say that age is, a risk factor to almost all disease, because as one grows older, you are more predisposed, you are more susceptible to a lot of disease, whether age-related diseases or regular diseases, because at that time your immune system dropped. So age is a factor, is a risk factor for glaucoma. When you are above 40, it is extremely important for you to have not just a regular eye check, but a regular health check, because at that age there is a lot of things going on within the body. Studies also show to us that ethnicity can also is also a risk factor. So those of us from the African region, blacks generally, are also at higher risk of having this condition. And that is why awareness and public health education is paramount in this part of the world. Also in the Asian race and also the Hispanic race, we also find that there's high prevalence of glaucoma. All right. Family history or genetics. This is very, very, very important. You find out that if a parent has glaucoma, there's very high chance for the children to come down with glaucoma. And so if you have a parent that has glaucoma, or an uncle or a grandparent or someone within your family having glaucoma, there's a high chance or a high risk for you to come down with it. And that is the reason why you must ensure it doesn't happen. Even if it happens, you should be aware and do the necessary, take necessary actions or measures to ensure it doesn't lead to total visual impairment. Also, some medical conditions and some medications can also cause, can just predispose one to having glaucoma. All right, diabetes, high blood pressure, not necessarily the pressure within the blood, because high blood pressure can cause some eye conditions that may lead, to glaucoma, and also as simple as refractive errors. Okay, studies have shown that when you are myopic, that's short-sighted, you could be predisposed to not just glaucoma, but a lot of retinal problems. Retina is the back of the eye, and that is where the optic nerve is, and that is the area the nerve goes out of the eye to the brain. So when that area is not in good shape, then you are predisposed much more to having glaucoma compared to those that don't have those conditions. So these are a few risk factors. There are quite a number of them, but for the sake of this presentation, we're going to limit it to these factors. There are common types of glaucoma. All right. The most common, which is over 60 to 70% of what you have out there, is what we call the primary open angle glaucoma. Now, what it means is that, remember I told you that there's a drainage, there's a pathway where this fluid drains out of the eye, right? Now, if that passage is open, if it's open, then fluid can go out of the eye normally. And so you see that most times patients with this kind of glaucoma are usually the pressures are usually fine some of the times, not all the times anyways. Okay, because you could also have more production, all right, more production of this fluid compared to outflow. So it's not a matter of the angle closing now, but it's a matter of an imbalance between production and removal, right? So if that happens, then you are having primary open angle glaucoma. So there's damage to the nerve cells. However, the angles are open. It's actually the most common type we have. If you look at the photo I have here, if you can see my cursor, you would see that is the angle I was talking to you about. So fluid is produced from somewhere around here, and it flows down this arrow here, and it flows out. Okay, I'm sure you can see my cursor on the screen. So fluid is produced from this point, it flows out from here, and it goes out through this trabecular meshwork into the blood, into circulation. Now, this is an open angle. So if you still have damage to the optic nerve head, which is behind the eye, regardless of this open angle, then that means you have primary open angle glaucoma. But if you look at below here, you will see that this angle is not as open as what you have here. There's a closure here. So you see that the fluid produced here can't even go out because there's a closure of this angle. It's not open, so you can see the fluid reversing back as signified by this blue arrow here. It's going backwards. So if that happens, pressure begins to build. And if pressure begins to build, it causes damage to the back of the eye. Those nerves begin to die out. Now, and that is what we call angle closure glaucoma. So the angles are closed. Now you could have another type of glaucoma we call normal tension glaucoma, or perhaps low tension glaucoma. So the tension within the eye, the pressure within the eye is normal or is low, but yet you still have damage going on. And that's why I told you earlier that when you have low ocular perfusion or perhaps increased glutamate within the eye, it can lead to damage to this nerve, regardless of whether the pressures are fine or not. That kind of glaucoma is called normal tension glaucoma. You could have secondary glaucoma. That means that something is causing the glaucoma. Another disease is causing the glaucoma. All right. So maybe you're having maybe diabetes, for example, or even if you have trauma to the eye and the eye becomes very red, you have what we call uveitis within the eye, and a lot of things is going on and it's not appropriately addressed. That could lead to glaucoma. Those kind of glaucoma that is caused by another disease entity entirely is called secondary glaucoma. So it is secondary to a primary cause. These are the common types we have. And just like the moderator mentioned, gone are those days where you have glaucoma only among adults. There's a kind of glaucoma we call congenital glaucoma that is found even with a newborn. As you give birth to a child, the child is having glaucoma. Although they have some genetic undertone and all of that, but it's also found with newborns. That's shocking, but and also sad, anyways. But it's like that. We call that congenital glaucoma, and there are others out there. But for the sake of this presentation, we'll limit it to these ones. How do you diagnose and how do you treat glaucoma? This area is large, so it's something we cannot exhaust in this thing. So the best the advice I would give is that everyone listening here, whether you are, in fact, it occurred to me, somebody asked me today as I was training my mentees, one of them asked, and that was yesterday, asked and said, I was training them on a particular test that we do in the clinic, and one of them asked if I have done it before, and that struck a chord in my mind. You know, I've been training these people. I've been training on that particular test for years, And it just occurred to me that truly they've not carried it out on me. That sounds very strange. So whether you are a doctor here, I'm sure most of we're even guilty of that fact more, because you take time to train people, you take time to treat people, but you care less about yourself. It's quite disheartening anyway. So it starts from you as a doctor listening to me today. You need to do a proper check for glaucoma. Go do this test you send patients to do all the time. Especially those that are above 40. Go do this test, because as you age, these things you are predisposed to it. So as I'm talking to I'm talking to myself. We need to also join the bad wagon of those going and checking their eyes routinely. So the diagnosis of glaucoma is not done by a quack. We have lots of them out there. So I'm using this opportunity to educate you also to know who you should go and meet. Not everyone that has an outfit that can give you what you need as far as thorough health check is concerned. So you have the responsibility to know who a quack is and who a professional is. Do that, and then you would get the right diagnosis. Okay, so the optometrists, or the ophthalmologist will have a thorough check on you, do a lot of tests. There are quite a number of tests you do. They will check the back of your eye to be sure that the optic nerve looks good. They will check the pressure in the eye to be sure that the pressures are within the range, the normal range. They will also do some other form of scan, if needs be, to see if there is any damage behind the eye. The nerve goes to the brain, so they need to also check that area thoroughly. And with all of these tests, a diagnosis can come forth. And if there is any form of damage, treatment begins. Just like I mentioned earlier, there is no cure for glaucoma anyway. However, we can slow down the damage. We can slow down the disease progression. No doctor will tell you that they can stop glaucoma. You see, some of the things you hear online, come and take this eye drop. This eye drop is a miracle eye drop. It cures cataract. It cures glaucoma. It does all of those things. You don't need to be told that people like that are just looking for what they will put in their pockets. All right. So there's no eye doctor that will tell you that there's a cure for glaucoma. In as much as there's a lot of work, a lot of research work going on the background. All right. There's stem cell therapy. There's a lot going on to see if you can change the visual impairment that is caused by glaucoma. Yes, there are some successes, but it's not so full blown that it can be FDA approved to say, okay, yes, we have a cure for glaucoma. Technology also is helping largely to see how you could assist those that have become visually impaired due to glaucoma. You see, so there's a lot going on, but nobody will tell you that if you take this medication, if I give you this drug to swallow, or if I give you this eye drop, it's going to cure glaucoma. Nobody will tell you that. But what we can assure you is that if you come early, if this condition is detected on time, if total visual impairment or blindness will occur, say in 5 years, 10 years time, we, based on our management plan, can push that date further. Instead of glaucoma causing blindness by 5 years, we can say no, we'll push it 20 years later or 10 years later based on the state we met it. So this is what we do, okay? There's no cure for it, but it could be properly managed. And you could still have a good life. Your quality of life will not drop. You will not need people to lead you around, to do your usual regular tasks and all of that. You will still have your vision to go about your daily activities. So this is a clarion call for every one of us, both optometrists that are listening to me today, students, clients, whoever is listening to me or is having a session with us tonight, to ensure that they visit an optometrist, visit an eye doctor, and get these checks done. Now let's look at this theme. This is actually the theme for this year's World Glaucoma Week. All right. There must be some form of integration. There must be some form of cohesion amongst all stakeholders for us to ensure a glaucoma-free society. If you ask me, we still have a long way to go, particularly in this part of the world, where there's still a lot of mindsets, a lot of myths going on concerning eye care. Aside some of the constraints of costs and all of that, there's still a lot to be done as it concerns education and reorientation of the public as it concerns this. And so there's need for us to unite to ensure that we silence this silent thief of sight called glaucoma. And so why must we unite? I've said that before, that glaucoma is often asymptomatic. That means you don't have symptoms. It doesn't present with any symptom. Okay. Also, if you it does not present with symptoms, it means that you wouldn't know if you have it. You are not aware until sight is lost. What will tell you that you have an eye concern is when vision is gone or vision is almost gone. Most of the clients I have diagnosed of glaucoma, most of them even come, some of them will come with a friend. They are not the ones that came for an eye check, but they just came with a friend and reluctantly, they want to just check their eyes. Okay, since I came here, let me use the opportunity to do so. And sometimes you see that most of these people are glaucoma suspects, and at the end of the day, diagnosed of glaucoma. So you see, there's no culture of routine check. And this is one of the things we must build. There's a collective responsibility. There's no single clinic. I can't do it alone. If I talk from now till next year. My voice is too small in this vast world to be able to achieve this goal. So there must be collaboration. There must be some level of collective responsibility. Not just my clinic, but every clinic, as far as it has professionals in them, because every professional will be involved in things like this. You should not allow this week to go by and you don't say anything about glaucoma, or perhaps assist, to ensure that you do free checks, go for outreaches to see how you could reduce this burden. So it's a collective thing. You, me, even the layman can also contribute. Yes, the government also has its role to play. Eye care in Nigeria, not just only in Nigeria, in the world, is costly. It's not easily, it's not so accessible in terms of cost. But in the Western world, there's some level of health insurance that covers that. We are trying here in this part of the world. However, there's still a lot to be done as far as this particular group of people with glaucoma is concerned, because the medications are quite expensive. You are having the medications, you have to use them for life, and all of that. So the burden, the economic burden is high, and this is where government can come in. Donor agencies can come in, community workers, people that can do something to assist in ensuring that we have a glaucoma-free society. Uniting, of course, ensures that even the undeserved regions gain access to essential diagnostic tools and treatment. There are people today that sees blindness or blindness due to glaucoma as demon possession, or as witchcraft, or as one attack from village people, from family, from some form of metaphysical etiology or cause. You wake up in the morning and you don't see again, and they attribute it to some spiritual cause, whereas it is glaucoma. So we need to reach out to these people that don't have access to proper eye health checks, so that we can also help in uniting and causing a glaucoma free world. How do we achieve this? Everyone needs to be alert. You have to alert everyone to have regular eye checks, and not just eye checks that you cover one eye. Can you see? Can I see? No, going beyond that, you need to check the back of the eye. I think the last webinar we had, you could go check on our YouTube handle at TREVEC.21. That's our YouTube handle. Check that. You see all of our videos. The last webinar we had was the eye as the window to the body. And so looking into the eye as a professional, you can tell a lot of things. One of the things you can tell is glaucoma, if there's glaucoma there or not. So a peep into the eye could save a life. I keep saying that it's better to be born blind than you born with your eyes seeing this wonderful world and then you lose it. It's devastating, trust me. Also, how can we achieve a glaucoma-free world? Is to detect glaucoma at its earliest possible stage, because that's the only time treatment is effective. I told you earlier that there's no cure for it. If the process has started, it must be completed. So we must find it out early so that our intervention makes sense. If you come in with late-stage glaucoma, sadly, there's nothing much we can do. But if you come in early, even before vision starts, your visual field starts constricting and all of that, then there's a lot that can be done. So that's one way to ensure that we have a glaucoma-free world. And of course, bringing communities worldwide to fight together against glaucoma blindness. Bringing communities worldwide, not just only in Nigeria, there's a lot going on in the Western world, and we also as Nigeria, wherever you find yourself, you must be able to contribute. That is why World Glaucoma Week, if you observe, it has a whole week to itself. Other concerns or other health concerns have a day attached to them. Okay? For example, World Sight Day, World Hepatitis Day. These are one day that it is used to celebrate or create awareness. But because of the enormous, the enormosity rather of glaucoma, a whole week is dedicated for it because there's so much to be done. And so we must continue to do that. These are the key pillars to ensuring a glaucoma-free world. I start already. Awareness is very important. Screening also is very important. Ensuring that you screen patients, for glaucoma, not just for eye or for visual acuity, because some persons come around and say, "Oh, my office wants me to check my eye, and this is the only thing, VA, visual acuity, how if I see well or not." Do you know? Let me tell you this: a patient with glaucoma can have the best visual acuity. It's possible. So when they come around and they say, "Oh, it's only my visual acuity I want to check," so I cover my eye and I read. They can read. Most of them can read everything on that your chart. But the question is, something is going on at the back of the eye that you don't know. So the screening we're talking about here is not visual screening. It's not VA, visual acuity screening. It is glaucoma screening, whereby there are other tests you must do. And of course, there's adherence. Another challenge that most patients have, that at the end of the day, they still end up, having severe visual impairment from glaucoma, is adherence to treatment. I said earlier that the treatment for glaucoma is actually a lifelong treatment, especially if you are using medications, eye drops. There are also some forms of other interventions, surgical intervention, that may not necessarily make you use eye drops constantly, However, you still have to check. The treatment is for life. There's no surgery that will stop glaucoma. The surgery you do is to help, control the pressure within the eye. So don't say, somebody told me that if I do surgery, the glaucoma will stop. That's not correct. Do the surgery, the pressure may be properly controlled. but it doesn't stop the glaucoma. So there's still constant, you must have constant follow-up as far as that is concerned. And of course, lastly, advocacy. Policy changes, fundings, and all of that can also help. There's less, optometrists as far as the urban center, the rural centers, I beg your pardon, are concerned. Healthcare centers. In fact, the healthcare centers are not even properly funded, not to talk of having optometrists there that could help diagnose these conditions on time. So there needs to be policy changes that would ensure the right healthcare professionals in these areas so that these issues can be properly addressed. You can join this movement, I've said this before, by ensuring you get tested. Don't sit back in your clinics and watch what's going on. You may make money if everybody goes blind or if everybody has visual impairment. But what about you? What about your friends? What about your relations? What about your family members? So you must start by getting yourself tested, then spread the word, educate people, your family members, your friends, in your assembly, wherever you find yourself, religious organizations, talk about these things and let people know about this very, very, very serious eye health concern. We'll stop here by saying vision loss to glaucoma is permanent. However, blindness from glaucoma is preventable. I'll repeat that. Vision loss to glaucoma is permanent. However, blindness from glaucoma is absolutely and totally preventable. The patients that we have been managing for years, and their vision is fine. They've not gone blind yet. They still do their regular tasks. And that is one of the things every eye care professional can assure you if you come in early. So let us unite to ensure that nobody loses their sight to these silent thief of sight. I call on everyone here listening to me. At every level you find yourself, you can contribute to these clarion call and this campaign to ensure that glaucoma is totally, or if not totally, but minimized. Its burden can be minimized in our society. I thank you very much for listening. Over to you, Mr. Opayemi. If you have questions, you can bring them up right now. Thank you very much.
All right, thank you very much, Dr. Osazee, for the educative presentation. One important thing I actually learned from this presentation is that we should go for test examination. As you know, glaucoma is a silent thief of sight. It doesn't give you notice. It doesn't come up with any symptoms from the onset. So it's better we go for eye checkup to know where we are. Thank you very much once again, Dr. Osazee. So at this point, we move into the question and answer section. If there's anyone with question or contribution. Any question? If you have one question or contribution to make.
All right, I think Lianos is trying to say something.
Hello.
Yes, sir, we can hear you. Good evening.
Oh, okay. Mine is, I want to thank Dr. Osazee for demystifying glaucoma, which is this silent thief of sight. I've actually been on transit, but I tried everything possible best to follow. And I must tell you, he has reminded us things that we know but we have forgotten, and some new things. Dr. Osazee, God bless you for the wonderful series that you have always been taking. We appreciate it. I want to ask one question, maybe to help enlighten Well, these are some of the questions some clients will always ask. Though you have your closing statement has actually answered it. Now, in comparison with people that did surgery and the ones that do not undertake surgery, which ones will get to absolute blindness faster?
Okay, so if I got your question, you asked that those that had surgery or those that
Okay,
have underwent.
let me rephrase it. There's this school of thought that
Okay.
glaucoma patients that undergo surgery, most times they progress faster than the ones that do not undergo surgery. So do you agree with
Okay.
that or you differ?
Okay, well, there's a lot going on there. There's a lot of sides to it. So take note that surgery itself has its complications. Okay, so opening up the eye has already caused let's say an imbalance within that structure. So, and that is why how successful a surgery will be, the surgeon will always tell you that there may be a few side effects, and so we must also work and plan for that. So it depends on the surgery. It depends on the type of surgery. Today we have less invasive surgeries. Okay, that will minimize these complications and may cause this problem in quote now to worsen. Okay, so depending on the type of surgery you carry out, okay, because I have sent my patients sometimes for some surgeries, and I would list them, tell them this is what it is, this is what it costs, these are some of the complications or some of the side effects, these and all of that, and of course, based on the present condition, you advise the patient. We are to do that to ensure that this patient doesn't come back as they were. So, in answering that question, you must it's a yes, no, based on the complications associated with that surgery. Yes, like you said, I have seen some patients that have gone, for a particular type of surgery, and at the end of the day, it is worse. Some others have come based on complications. They come in, and at the end of the day, they have some form of refractive error is worsened. The pressure, even at that, was controlled after some time. There's also a blockage again, and they have to go back for a reopening of that channel and all of that. So this happens. However, I've also seen some surgeries, some surgical cases that are fine. There's little complications associated with it. So it depends on the type of surgery that was carried out. So I wouldn't say it's a definite. And for those persons that may also be on medications only, may also be endangering themselves. Let me give this counsel. What I do, this may differ from others, but what I do is that surgery is not always the first point of call. Okay, if you use medications, all right, to control the pressure in this time, and medications is working, this patient, you've tried monotherapy and it's working fine, one eye drop, and the pressures are properly controlled when you follow up. Why do you want to send this patient for surgery? It doesn't make any sense to do that. All right. But the only time we suggest surgery is number one, pressure is so high, and two, whatever medications you're giving is controlling the pressure the way we want. Then we can opt for surgery. Or perhaps this patient is forgetful. Instead of you taking your medications every night, twice a day, you skip it, you're so busy, and all of that. So at that stage, we also advise for surgery. Also, when this condition is found in a child, a young child, for example, a baby, would you want to place that child on medication at that stage till the child grows up? You see, so when you come in contact with scenarios like this, then you opt for surgery. We don't just send the patients for surgical intervention, just like that. There must be a very good reason for it. And if there is, you should advise the patient, what kind of surgeries. We have laser procedures today that is much, much less invasive. I don't know if I answered your question, sir.
Yeah, you did. Then, but there's a follow-up from your answer. Now, at what age is it best to consider one as a child to recommend surgery as maybe part of first line of actions? What age do you think is best? What age range do you think is best to say, okay, this age range we consider as a child that you might not be careful in use of medications, or then I'll recommend surgery for you?
Okay, so that also differs. There's no age, there's no particular age you see. At this age, when you get to this age, you start using medications, or when you get to this age, you start using. I don't want to say I've not seen any what's the word, any guideline for that. I don't think it's even there. Okay, so this depends on the risk factors. There are a lot of things. Those that are actively involved in managing glaucoma, there are a lot of things you look at. Okay, you look at the predisposing factor. If there's a strong history, positive history of glaucoma in that family, and of course, the state of the eye, what you're seeing at that point, will determine how rigorous, or how, what's the word, for lack of a better word, the urgency and the approach you would use, to intervene. So it depends. There's a wide range. It's not fixed age. But what I always advise is this patient, if this patient, but absolutely, if that child is a baby, okay, young baby, like for example, congenital glaucoma, for example, I don't need to start using medications for that. That's an absolute surgery from that age. You have to just get it done to help preserve the patient optic nerve head. So for babies, surgery is usually recommended as first point of call. But when that child is already growing up, you can now have, you can now look at the critical, concerns. Requires whether you send for surgery or you could start with medication as a first point of call.
Thank you so much for your response, and I appreciate your series. Thank you, as we'll continue to learn from you. God bless you and increase you more in wisdom.
I appreciate your presence, sir. Thank you so much for joining me. God bless you.
Yeah, thank you, sir. Yes, sir. Okay.
Thank you, sir.
Thank you so much, Mr. Osazee. Thank you so much for this enlightening webinar.
Thank you, Dr. Princess. I appreciate you, man.
Do you have any other question?
Yes, I can see Dr. Chinasa's hand is up.
Okay, Madam Chinasa, do you have any question?
In asking your question?
Okay, good evening all. Good evening, Dr. Osazee. Thank you for this educative topic, glaucoma. I really appreciate. And please, I have a question. I don't know if I heard you well. You said something about glaucoma. You say that glaucoma doesn't have symptoms. So I want to ask, what happens to close angle glaucoma? Does it equally not have a symptom? That's my question.
Thank you very much. So when we say that glaucoma doesn't have a symptom, we're talking about the most common type of glaucoma. So just like I mentioned to you, about 70% of the glaucoma cases you find are actually POAG, that's primary open angle glaucoma. All right, so in a few cases you find secondary glaucoma, you find angle closure glaucoma that, of course, have symptoms. Okay, so for close angle glaucoma, in fact, that's one of the easiest glaucoma to manage, because it comes with a lot of alarming sound. Okay, so there's quite a remarkable, significant symptom for that, with serious excruciating pain, redness in the eye, halos are seen around light, and all of that. So these are symptoms that the patient will have, and the patient cannot bear it. They will run to you. They will run to any eye clinic around or any pharmacy like they usually do, to seek for help. So yes, acute angle closure glaucoma has symptoms, just to get that clear. Thank you very much for pointing that out.
Good evening, Dr. Osazee.
Good evening, ma.
Okay, I want to say a big thank you for these teachings, and I just want to ask just one question. Though I came late due to busy schedule in the house, so I want to ask: is glaucoma, can it be cured, and what are the causes of glaucoma? What causes it?
That is making me go back again to give the whole lecture. So you came in it, but thank God that this episode will be available on our YouTube handle, so you could always check it out, and also on our website. So, but just to quickly answer you, yes, glaucoma does not have a cure. Still trusting that one day, someday, science will give us a cure, an absolute cure to glaucoma. What you find out, what we have right now are still, there's a work in progress. Okay, and what causes glaucoma? Like I said earlier, there's a lot of predisposing factors. There's a lot of pathophysiologies that science have also found out to lead to damage to that nerve or to those nerves. There are quite a number of them. Pressure, increased ocular pressure can be one of it. Reduced blood flow to the area where the nerves are can also be another reason. And also, last thing I mentioned was increased glutamate level. Glutamate level is one chemical, I will put that in quotes, that is found in the eye that causes damage to the eye, to the nerve. Okay, so these are the causes of damage to the optic nerve head that will cause glaucoma. I don't know if I answered your question now.
Okay, thank you for that. I really want to appreciate, but I want to maybe I'm going backwards. Like I said, I came late, but as a layman, like you call it, like we're not professionals. How can we detect when we have glaucoma? What are the symptoms for us to know that, okay, I'm having these symptoms? I need to see a doctor to know, okay, this is glaucoma, or my eyes is going this way or something like that. So how can we detect it?
Unfortunately, you cannot, okay, except it is that very the one that that has symptoms, okay, and it is very, very low. It's not very common. The type of glaucoma that presents with symptoms is not very common. Okay, we call that acute angle closure glaucoma. But the one that is most common does not have symptoms. So you have to subject yourself to a professional eye doctor that will be able to help you find out if you are having glaucoma or not. So you cannot do that yourself. You cannot do that. So a visit to the clinic would help that aspect.
Okay, thank you so much. I really appreciate for those teachings. God bless and continue to grow TREVEC. More wisdom in Jesus' name.
Thank you so much. I appreciate that. Thank you so much.
All right, thank you very much, ma'am, for the question. Do you still have any other question? Any other question? Okay, in the absence of no further question, on behalf of Treetop Vision Eye Center, I would like to thank every one of you that attends today's webinar on glaucoma, the of sight. We hope you found this section enlightening and educative. Thank you all for joining today's webinar series. I want to introduce TREVEC website. It's currently on the screen, www.trevec.com.ng, where you will have access to our blog articles, recent updates, and to learn more on the eyes and general health. Also, our YouTube channel, at TREVEC.21, where you can actually go and watch our previous videos and more educative videos too. Also, do well to follow our social media handles at Treetop Vision Eye Center. Thank you all for joining today's webinar. And please remember to apply what you've learned today. And do not hesitate to visit an eye clinic if you have any concerns or any needs about your vision. Thank you once again. Thank you, everybody, for joining today's webinar series. Thank you all, and have a wonderful evening ahead. Goodbye.